All right, so to wrap some of this up, let's just talk about the biophysiology as well. So, to kind of look back at this. So, there are two theories about why we sleep more or less. So, the recuperation and adaptation. So, things are less active at night, so we can conserve our energy at night. Recuperation because our brain needs time to engage in neuroplasticity. And for some reason, if you don't sleep, you die. Well, sleep's weird. We have our non-REM sleep stages as well as REM sleep, and the difference is there. REM is the brain is active. We have rapid eye movement, but the body is usually atonic, not really moving at all. But you can see changes in heart rate and blood pressure. This is where a lot of dreaming occurs, but not all. And, stage 1 and 2 are your transitions into that deep sleep. Stage 3, and depending where you look, sometimes 4, are your deep sleep, your N3 sleep, which seems to be the most restful of the types of sleep. Okay. If we have sleep deprivation, we see people become sleepy, but more likely if they wake up during like our slow wave sleep versus if someone wakes up during REM. So kind of an interesting thing there. Our circadian rhythm, our daily cycles of bodily functions, darkness triggers melatonin, which triggers us to sleep. That's why we can exogenously or outside the body take melatonin to help with that regulation of the circadian rhythm. And there are 4 primary areas of the brain that appear to be involved in sleep. So we have our posterior hypothalamus, which is associated with maintaining wakefulness, our anterior hypothalamus, which is associated with maintaining sleepiness, and of course, some of the neurotransmitters that are involved there. So we have orexin and histamine and, and we have GABA, right? And then reticular formation, if there are low levels of excitation, it promotes sleepiness, high levels wakefulness, and then the caudal reticular formation, which seems to regulate rapid eye movement sleep. Insomnia is difficulty sleeping for 3 or more nights for 3 or more months, and CBTI is our first line. Always great to recommend sleep hygiene and medications that can be used. We oftentimes will reach for our Z drugs when we need to, but there are other options, things like melatonin, doxepin. We can use benzodiazepines, but they've kind of fallen out of favor due to risk versus benefit. In most cases, antidepressants and antipsychotics should only really be used when there's another compelling reason to use those products to help with sleep. When it comes to hypersomnia, there's the 3 primary kinds, right? Idiopathic hypersomnia, narcolepsy 1, narcolepsy 2, where 1 is the type of narcolepsy that has cataplexy, that falling experience. And the primary first treatment for the hypersomnias is going to be stimulants, particularly modafinil. However, we also have oxybate salts, which help to improve deep sleep, which seems to improve daytime wakefulness for individuals. If someone has sleep apnea, we give them air. Sleep apnea, give them air. Sleep is incredibly important. We don't know why, but it is incredibly important. Too much sleep can increase risk of cardiovascular disease, stroke, mortality. Too little sleep, increased risk of cardiovascular disease, stroke, mortality, other chronic conditions. So it is important to try to get an appropriate amount of sleep and get good quality of sleep and do the right things to sleep